Well, good morning, everyone. It's another wonderful Monday morning here at Health Plan Markets. Today is April 18th, 9:02 a.m., and thank you very much for being on this call. As you may know, we are here not just to earn a wonderful paycheck and a wonderful living, doing what we do best, and that is improving the lives of our community with affordable health care. So thank you for being a part of that mission. And thanks for being on this call early, bright and early on a Monday morning, ready to go get it. So as we normally start our calls, I've got a couple of really great things I want to share with everyone today. So I'm really glad that everyone's joining in here. I'm going to go ahead and share my screen for our main thing that we do every week, and that is training, right? We always have to keep one foot in the classroom and the other one in the field at all times. And I hope everyone had a fantastic Easter weekend. Hope everyone was safe and healthy and got to visit with your family and get rested and charged up for the week that we've got going on, because we got lots of people to help out there, and we want to do our best. So hope everyone had a great weekend. All right, so looking at today, we've got quite a bit of training going on. And as a reminder, we've got our webinars that are rolling throughout the week. So I'm going to mention those this morning. The first one today is at 10 o'clock for our Marketing Match program. That's where we match you dollar for your marketing. So if you're interested on seeing how that program works, we've got a session today at 10, Tuesday, Wednesday, Friday, and Saturday. And again, you can check our training calendar for the dates and times on that one. This morning, we do have some special trainings here. We've got a coffee chat with Devoted. They're doing that weekly at 11 on Mondays. This one's geared for the Orlando market, but all are welcome. Also at 11 today is Medicare community-based marketing. So this is a really good one. We're going to talk about community-based marketing this morning because this is a really hot topic, especially going into lock-in, where many of you are asking, now what? Now what do I do? Okay, this is a really big part of that. So if you can join today at 11 and figure out how they are doing community-based marketing here. Also at noon, Sergio, Nick, and Victor are available for a chat in case you have any questions about your marketing or you need some help setting up a strategy. Also today, we've got a 1 o'clock training for ACA training. There's been updates for ACA. That is rolling today at 1, but we also have sessions on Tuesday, looks like Thursday morning, Friday, and Saturday sessions in case you want to jump on one of those. Clever RX, really great lead gen opportunity. That's today at 3. We also have a session on Wednesday, Thursday, Friday, and Saturday, so you can jump in on one of those sessions. And then at the end of the day today at 7 o'clock, we've got HPM Shop live training webinar. We're going to talk about HPM Shop. We've got those sessions happening also on Wednesday, Thursday, and Saturday. Okay, so check that out if you need that. Moving on for the rest of the week, we've got Devoted training, open training session at 11 tomorrow. Devoted is a hot topic, one of the fastest growing Medicare Advantage plans in the country. They are doubling, possibly tripling their footprint for next year. So if you want to get a sneak peek on Devoted and all the great things that they're doing and how they're taking, check out that training tomorrow at 11. We also have our Working with Doctors training, and we've gotten some really great feedback on that. That's tomorrow at 1 for part 1. And we're doing part 1 training series throughout the week, and then also part 2. We'll be rolling out part 3 very shortly. So if you've done the part 1s and part 2s, we appreciate you guys being on those. Nick and I put together a really great training. We've got some great feedback on that. So if you haven't watched those or joined our webinar on that, please jump in on one of those sessions, and that's this week. So we have the part 1 tomorrow at 1, on Wednesday, and then on Friday and Saturday, and then part 2 is on Wednesday, Thursday, and Friday of this week. So you check the calendar and pick a date and time that works best for you. And we'll be talking about getting you working with doctors. This is required if you are looking to have Health Plan Markets help you find a doctor. So if you're looking for a doctor to work with and you just don't have one, you're going to need to go through these trainings first, because there's some required information that we need you to know versus just popping you into a doctor's office. So that's really important. Moving on to Wednesday at 11 o'clock, we've got time management and SEP review training. This is fantastic. Time management is always something I'm studying. Let me tell you what, doesn't matter, how much you're doing. If you want to get busier and more efficient, time management is huge. And SEP review, we're going to talk about that today as well. But on Wednesday at 11, they're doing that training session there. So it's really great for you guys to brush up on that. Also on Wednesday, 2 o'clock, Humana is doing their care highlights with CenterWell. So if you're in a market with CenterWell, you want to learn a little bit more about how Humana and CenterWell are working together, check that out. That's Wednesday at 2 o'clock. Also on Wednesday, Optum Agent Academy. That's at 4 o'clock on Wednesday. In order for you to be assigned an Optum doctor, you do need to attend an academy. In fact, if you're going to do anything with Optum, any marketing, any events, they're going to need you to be, privy to what their brand is like and what they're doing on their side at the clinic. So make sure you join one of those sessions if you are not already certified to work with Optum. And again, if you're confused, just get with Nick. I'm pretty sure we have a list of folks that have gone to the Optum training and we can keep track of that for you. Moving over to Thursday, the 21st, 9 o'clock, Cigna is hosting LIS and Medicaid training. Super important right now, guys. We're in lock-in. You got to know how to do LIS. You got to know how to do Medicaid. I'll be putting together some training sessions and some decks, so that way we could host some lock-in training to keep you guys moving. But in the meantime, that's a great training Thursday at 9 o'clock. Cigna is doing their LIS and Medicaid training. Also on Thursday, Devoted's doing another coffee and chat session. This time it's 11:30 for the Jacksonville market. Jump on there if you're interested in getting that done. Again, the rest of the week is those webinars that we're hosting throughout. So if you have any questions on this, please let us know. We want to make sure that you are absolutely trained. Please remember, we've got to keep one foot in the classroom and the other one in the field at all times. Yes, we always must be learning. Okay. I do want to talk about the opportunities that are out there that I'm seeing right now with what we call event coordinators or community liaisons, if you will. And these are folks that actually work at the health plan or the provider groups. Okay, so at the doctors have reps, and some of these carriers have reps. And I'm seeing a very big disconnect from folks that I talk to, agents, that when I ask them, I say, are you working with a rep? And they're kind of like, what do you mean? So there's two folks that you really need to be in sync with out there that could help you grow your book of business. I'm hearing some great stories out there. But the first one is if you're not privy to the doctors or you're looking for opportunities with provider groups, the provider relations or marketing rep at the provider groups are always looking for brokers to work with. There are some MSOs or IPAs that have lots and lots of reps out there to work with. And it's really about making friends with those folks. But the other side that I wanted to share with you that I don't think many of you are taking advantage of is the community liaisons at the health plans or the event coordinators at the health plans. And there's some really great folks out there that are looking for brokers to work with. Some of them are so aggressive that all you have to do is just show up, and they've got apps on the table. I mean, they have people that are coming up and saying, hey, I want to enroll today, right now. So you're only going to get those opportunities if you're making friends and you're working with those particular event coordinators. So some of the carriers that I know that have event coordinators or community liaisons out in the field are United Healthcare. Humana has people out there. Freedom is very, very aggressive. They just hired a bunch of people to go out there and do that, and Devoted as well. So what are these folks, what does their role look like typically, right? So they're out there. These are typically unlicensed people. And let's just use the gentleman that I met last week, Mr. Randy Beck, and he's the manager. And Randy goes out and he looks for events. He'll find a flea market, he'll find a health fair, he'll find a food pantry, he'll find a Medicaid office, he'll find a doctor's office, and he's out there looking for. This is his job. It's all he does, and he's not allowed to sell the plans. He works for Cigna. He doesn't sell the plans, and his job is to find the opportunity and then plug an agent in there. And so if you're not connecting with these people, if you're not, at least knowing who they are or asking for opportunities, and don't be afraid to ask, guys. If you're just sitting back and waiting for your phone to ring and say, hey, I got a great opportunity. If you've never met these people, it ain't going to happen, right? So reach out to them. Many of you are on, just as Randy as an example, many of you are on the email list, for folks to, get the information from Cigna specifically. So you can respond right back. You can email right back to Randy and say, hey, Randy, Justin had mentioned that you've got quite a few opportunities out there, and I just want to let you know that I'll make myself available, and I want to be part of your team, and I'm willing to work. I'm willing to do whatever. Now, here's the thing I will say about these opportunities in general is this. If you keep saying no, or you're unavailable after you said you want to work these events, they're just going to keep moving on. They're just going to move on to the next person. And the more you're consistent, the more you're available, and the more that you actually come through for that person, the more opportunities you're going to get. If you're flaky, if you kind of show up, if you're late, if you're disheveled, if you're rude, they're not going to want to work with you again. They're not. They've got way too many brokers to work with. They have the pick of the litter. And so you want to make yourself attractive to these folks. Show up early. Be prepared. Look professional. Act professional. Be polite. Be fun. Be friendly. And work hard. If you want these opportunities, if you really want these opportunities that are out there, and some of these folks are getting opportunities, because they're out there every day. The more you're out there, the more you're going to get them. If you're just kind of doing onesie twosies, it's not going to work, guys. And then also, doing HPM shop, which we're going to talk about today, reporting your applications. If you're doing manual applications, I'll pray for you. But if you're using HPM shop, then your applications are reported, and then Nick has ammunition to go to the carriers and to go to the provider groups to say, hey, look at how many sales that Justin did for you this week. Look how many sales that Chris did this week. Look how many sales, Gail did or Mike did. He's going out there and having these conversations and saying, hey, look how great you're doing. And that's how we open the door. But we can only do that if you're A, using HPM shop, so we can track those sales and know that you're actually working, or B, you're reporting the applications. And everyone knows how to do that. And if you're lost, please reach out to a team member, and we're glad to get you set up. But just wanted to say that this morning, that I think there's a huge missed opportunity for that. And I really hope that people, step up. And if you're looking for more things to do, this is a huge missed opportunity right now, because these reps are looking for folks to work with. So carve your way in. Also on opportunities, we are going to be investing in preset appointments. Now, these preset appointments are not going to be free. They are very expensive. And so if you are interested in possibly purchasing preset Medicare Advantage appointments, please reach out to one of us. We're just creating an interest list right now. You don't have to pony up any money, but it looks like they're going to be about anywhere from $40 to $45 for a preset Medicare Advantage enrollment. There's different ways, different programs that we're looking to connect with on these. But so far, the quality of these appointments are really, really good. We're doing some beta testing right now. But so if you are interested in possibly purchasing appointments for new folks, please let us know. Just shoot somebody an email, and we're going to create a wish list here. Again, it's nothing coming down the pipe tomorrow, but if you are interested in that program, please let us know. Okay, let's talk about SEP opportunities, because there is a lot of them out there. And the one that comes to mind here is Cigna. Cigna's popped up quite a bit of SEPs here lately, especially because of the weather. And we're seeing this trend pretty much across the country and pretty much across all carriers. So I'm starting to see that the carriers are getting a little bit more organized on this. The first one is Cigna here, and they put out a document called the Disaster SEP Application Tips, and they released that on April 11th. So you can go back and check your email. But if you're on the screen right here, you can see that there are instructions on how to submit a disaster-related special election period on HPM Shop using Cigna. So once you select Cigna as the carrier of choice on the application, you're going to see the special enrollment periods, and the basics are there. You can see that. But at the very bottom, it says, I was affected by an emergency or a major disaster. Okay. So you got to select that. Okay. So, on the instructions, it says there are 2 key fields in this section to complete for a disaster-related SEP. And again, guys, this is specifically for Cigna. Not every carrier accepts every SEP. So you have to be very careful with that. You have to study this, and there's a way to do that. And I'm going to share that with you today, okay? So that's the first part. The first part is you must select the missed election period for the customer and enter any date information as applicable. Okay, so in this particular instance, it's going to say that they were affected by a major disaster. So you're going to click the box that I mentioned below. And it says you must also select the DST box for disaster-related applications. Selecting this box and the correct missed election are critical to the application being processed correctly. Okay, so be careful with that. There are some additional notes on here, and it says the agent notes under the agent information section. It says use this section to add any notes regarding the DST. And so they have an example here. It says the customer moved from Virginia to Tennessee on January 1st. She missed her election period for the move due to the tornadoes in Tennessee on January 10th. So the more specific you are in this, the better. She had to relocate to another state until 4/15 and now needs to enroll in a Tennessee plan. Okay. So tell the story so that it's clear what election the customer missed, what disaster-related SEP the customer should be eligible for, and what dates the customer was affected. Now, it sounds like the dates are ultra important, so just make sure you have a good timeline and it makes sense for the SEP. So if they missed OEP because there was a tornado or a disaster-related event in your area, please know that and then put the appropriate dates in there, okay? Now you're asking me probably, Justin, how do I check which SEP is available in my area or my selling territory? But there's a resource, and this is specific to Cigna, but all of the carriers are starting to put these resources out. So just pay attention to your emails. I know all of you do that, right? And you should be able to pick out those SEPs, okay? So here's a resource here. Always check the SEP tracker before taking a disaster-related application to ensure that there is an SEP for an area and that Cigna is participating in that SEP. Now, just because Cigna accepts the SEP does not mean United will, does not mean Humana will, and vice versa. So it's specific to the carriers and it's specific to the area that you are living in, okay? So Cigna does have a tracker available on their producer university under agent communications. I'm going to show you how to do that, but if you have any questions, you can email Cigna. You guys know how to do that, hopefully. So this is what the resource library looks like. When you go to your Cigna page, from your homepage, it shows, you click the resource library there, and then agent communications, and then there's a drop box. The very first thing is that drop box there, and look at all of the SEPs available. So you have Arkansas, Florida, Illinois, Kansas, Missouri, down and down and down and down. So SEP tracker here, you can click that. That's at the very bottom. That opens up the spreadsheet that they were referencing in that email that they sent us. So SEPs are there, they're out there, especially disaster-related events. Florida has one until July 31. You have to read these, so when you click it open, it'll show some additional information on that particular SEP, and this one is in Florida. Looks like they have Bay, Calhoun, and Gulf counties open. Tennessee, here's the counties here. And it just goes down and down and down and down and down, okay? So if you're looking for business, if you're looking for an SEP, that's how we do it right there, okay? So pay attention to that and make sure that that works well. Okay, the last part of the call today is I wanted to share with you our Connecture stats. And this is for, leading into 2022. This is our 2021 data points. And we met with Connecture last week. So HPM Shop did a phenomenal job. You guys did a really great job using HPM Shop for the first season that we've ever had it. So the company that helped us build HPM Shop is called Connecture. Connecture is utilized by several different carriers for their enrollment platform. So this is a industry-leading software company. And HPM Shop, they gave us some stats on HPM Shop on how we did throughout AEP. And there was a couple of stats that I wanted to share with everybody because it showed a trend and I had some concerns. And these are concerns that are going to affect you, your book of business, and most importantly, your clients. So we're going to go through that. The first thing is the guided help. And this guided help section is the section where you're not just skipping to the plans, you're actually putting in the information and you're following that needs analysis as the software was designed. So 92% of the applications that you guys put in, you are using guided help. Excellent, excellent job. Excellent job. I think that is phenomenal. We have to continue to use that. It really helps us tell the story on what's happening with the members, and it also does all the dirty work for you guys. If you're putting in the information properly, it's going to kick out the best plan for them. If you're skipping this process, then you're back to square one. You're going to have to think for yourself. You're going to have to figure out what plan is going to be best for them, and you could make a mistake. Okay. So guided help is a huge part of why we chose to work with Connecture and build HPM Shop. So great job on that. We'll keep that moving and we'll move on. So the next one is one that I'm getting more concerned about, and that is the prescription side. And it looks like only 60% of the applications were submitted with prescription drug information. And that's pretty surprising, seeing as though the average senior takes 2 medications. Okay, the average senior takes 2 medications. And this will never be 100% because we have seniors that take 0 medications, right? They don't take any meds. But, especially our T65s. But looking at this data, almost half of the applications that you guys put in were missing prescription drug information. That's concerning because the software is designed to find the best plan based on the medications that you put in for your members. So if you're not putting in the prescription drug information, then you're skipping a really key part of finding the right plan for the member. Remember, guys, if you enjoy residual commission, if you enjoy getting a check month in and month out from each one of your members, then it's critical that you put them on the right plan for the right reason. If you're having to chase these people around because they can't get their meds, because they told you that they were on a med, or they forgot to tell you that they were on a med, or you put in the wrong milligram dosage, then you're doing yourself a disservice and your client's going to go find somebody else to work with because you didn't take the time to put in the meds. Okay. Really important. And again, we have that available on HPM Shop. In fact, using the MyMedicare.gov sync account will pull down 18 months of medication, so you don't even have to put them in. All you got to do is connect their account, which is pretty awesome. So please make sure you're doing that, guys. That's a big part of this. The next one was even more concerning, is that it looks like only 29% of applications had a selected pharmacy on the application. So if they're taking meds, then they have to pick them up from a pharmacy, whether it's mail order or not. But we're not putting in the pharmacy. Looks like you guys are at this point kind of jumping over the app and getting to the plans as quick as possible. But we really need to slow down and pick the pharmacy. And I'm going to show you this morning why we want to do that. Okay. So please make sure that you're entering the medications, connecting the MyMedicare.gov account for your client, and then selecting a pharmacy. And you can select up to 3 pharmacies on HPM Shop. So, please make sure you do that. The provider section looks really good. I'm happy to see this, that you guys are putting in, 98% of the applications contain a provider of some sort. So very, very great job to do that, because, we want to make sure that they're going to the right doctors. So congrats on that. I think that's good. But where we need to improve on is the medication side. Okay. So let's jump over and we're going to talk about that medication side really quickly. So if you're following me online here, you can see that I've already jumped over to the logged me out here. Jump me over to the prescription drug account side. And I'm going to go ahead and pick a member here. We're going to go with Joe Dirt. And Joe is, already kind of started the process, but we're going to jump into the add preferences side. And again, you can see how easy it is to skip over this stuff, but we don't want to do that, right? So you want to go through, hit the continue button, go all the way through. But for the sake of what we were talking about today, we're going to talk about the prescription side. So I'm jumping over there. And yes, you can manually enter in all the medications, which I think a lot of you are doing. But if you take 5 minutes, and connect the MyMedicare.gov account, you will save yourself 20 to 30 minutes in the future. Okay? Here's why. Number one, I know that not every senior has a MyMedicare.gov account. That's why I'm saying you need 5 minutes, because you're going to bounce out to MyMedicare.gov. Okay? Here's the site. Click login and create an account. A disclaimer is going to pop up. You want to create an account here at the top. There's that disclaimer. You will need their Medicare number and the dates on the card. Okay. You also need an email address. And once you get them set up with that, then you can go ahead and send an email from your HPM shop, and it will connect their medications and pull down 18 months of their medications. Now, why is this important? Because let's just take a look at this lisinopril tab here, okay? Lisinopril is a pretty common medication. But if you click edit, look how many variations of lisinopril a person could take. You got 2.5, you got 5 milligrams, 10 milligrams, 20, 30, 40. How many are they taking? 30? How often are they taking it? Every 6 months? You could mess this up real good, because most people don't even know the dosage. You just know, oh, I take lisinopril. Okay. Unless you have the bottle and the frequency on there, you could mess that up pretty good. So if you're pulling down the actual medication adherence, then you're going to be way more accurate, and you're going to have a lot better compliance and sticky rate for your members. Plus, next year when they call you and they say, hey, that plan, it's not really working out for me anymore. What else you got? You already have all their medications. That just saved you a ton of time. A ton of time. You got everything saved there. So that's the first part. Now, let's go over to the pharmacy. So once you have the medications picked out, you're going to pick out their pharmacy. And again, you can pick up to, looks like it allows me to pick up to 4 here. But why is this important? Now, as you know, certain carriers have certain pharmacies listed as preferred and standard. Standard pharmacy is a higher copay than the preferred pharmacy. So if you're not selecting the pharmacies, then you don't know whether or not the medication could come out cheaper on Humana or United, because they both use different pharmacy networks. So the pharmacy is part of the equation in finding the best plan for your member. It's part of the equation. And in fact, when you go out to find the plans, if you have multiple pharmacies listed, what will happen is you can actually see which pharmacy is best, and it'll actually change the order of the plans based on which pharmacy you use live. So even if you select a mail order pharmacy, it changes the order of the medications a lot of the times. So this is another important feature here. So if you go to, right here on the left side, as you can see, we've got the plans listed. If you select a different pharmacy, it could change the cost of your medications. And when it does that, it could change the order of the health plans, okay, based on the prescription drug estimated out-of-pocket cost. So in this example, Simply is coming up number 1. But there are instances where we've seen the health plan just take over. Lisinopril is a pretty common medication. But it could change the order of the medications because of the pharmacy. So pharmacy is ultra important as well. So that's what I wanted to make sure that you guys are slowing down, taking time, adding that pharmacy, even though the member says, yeah, I'll go anywhere, just pick one or pick 2, and then you can compare which pharmacy is going to save them the most money based on the plan that they select. So, but all in all, really, really excited and very glad that you guys are using HPM Shop and doing what needs to be done on that, because it's going to save you a lot of time, money, and energy. And also, best experience wins for your clients. You look like a rock star when you're using this stuff. So that's it for today. Really do appreciate everyone's time. And as you know, these calls are being recorded. So if you do have a member in the morning at 9 o'clock, just know that clients come first, and we'll host these on our YouTube channel. So until next Monday, I hope everyone has a fantastic week. Take advantage of all the great things we shared here today, and I hope you have a wonderful day. Take care, everybody.